It's a challenge that policymakers face. And even though financial inclusion or ensuring that every Indian has access to money, whether it's loans through state-run banks or insurance, has been a mantra for the government, a lot more still needs to be done. And nowhere is the need as much as in basic healthcare. Insurance here can protect millions and ensure that a simple illness does not mean bankruptcy, as often is the case. For Kiran Mazumdar-Shaw, one of the best-known names in the Indian healthcare sector, healthcare insurance is an important and crucial cog in the wheel to ensure that the best of healthcare reaches all.
Hello and welcome to India's Healthcare Challenge with me, Kiran Mazumdar-Shaw. My guest today is Analjit Singh, the chairman of Max India, one of the leading healthcare stakeholders in our country. And over the next 30 minutes, I will be having a very interesting conversation with Analjit to talk about various aspects of how we can build a sustainable healthcare model with a sustainable insurance support system. Analjit, thanks so much for coming on this show. Now, you're someone who's really playing a very key role in insurance, and there has been a suggestion that whilst the government should be a health insurer or the health insurance provider, at least at a very basic level, the private sector health insurance companies should actually, provide the tiered health insurance kind of structure where you sort of top up on the health insurance needs and schemes and products. What do you think about insurance?
It's a very difficult and complex subject and question. Health insurance was never seen as a standalone vertical. So typically when you went to the PSU insurance companies, who were not standalone health insurance companies, they bundled health insurance in. So when you bundle something in, you are not pricing it mark to market or not pricing it to cost. So that set a very, very low table for health insurance pricing. So typically these insurance companies who price their products based on not actuarial, not realistic, not market-based data and experience, found that 100% of the time the claim was more than 100% of the premium. There can be no business model, because the fundamental of insurance is that hopefully on an actuarial basis over 10, 20, 30 years, the claims are less than the premium, and that margin or surplus is really what gives you the return in the insurance.
And the sustainability.
And the sustainability. Now that wasn't happening because 100% of the time the claims were higher than the premium. So when these standalone health insurance companies, or Sahis as we call them, came into the market, they started to price health according to the specific product. What are we delivering? What are we offering? What is the likely price and cost of that based on some projected actuarial basis of claim profile, if you will. So therefore, the private health insurance companies are charging more premium because their pricing is more realistic relative to these, may I say, at the cost of being sounding critical, the fuddy-duddy, public sector non-life companies who also do health. So a huge shift and adjustment is required. That means that firstly, these PSU general companies, non-life companies, I think should exit that space. And with more private health insurers coming in, there should be market-based pricing. And in this country, with the private life insurers coming in, there's such strong contest that you are getting best-in-class service, best-in-class product, very, very aggressive pricing, and so on and so forth. The same thing needs to happen in health insurance. Frankly, I think more should be left to the private sector. I'm not calling it public-private partnership. I'm calling it more government-private cooperation. And if government would listen to the private sector, I think if there are just 2 things or 3 things the government did, that is a favorable land providing policy, because land is too expensive at market rates for healthcare providers to acquire urban. It's practically out of bounds, but even in semi-urban and some rural areas. That's one area. The second area where government can help is encourage private sector to come in for medical education, for building training at schools for wellness professionals, allied health professionals, nursing professionals. Once that supply side goes up, the cities will decongest, the doctors will want to go and work in the semi-rural areas. But so long as the education
the human
resource is constrained, this shift is not going to happen. Of course, we can always go back to the finance ministry and ask for tax breaks and ask for some concessional soft loans and 30-year, 40-year money at some concessional, interest rates for borrowing and so on. I think those
are mechanistic kind of issues.
But that's where the problem is.
It's an irony that in a country where the government promises healthcare to all, the bulk of Indians don't have access to even the basics. And those who can afford it opt to use the private healthcare facilities. In fact, over 75% of healthcare expenses in the country go towards the private sector. While the big challenge for the government is to improve its healthcare facilities, it can partner with the private sector. And one way of doing so could be through ensuring good health insurance. In fact, micro-health insurance programs like the Arogyashri in Andhra Pradesh and Karnataka's Yashaswini have been model insurance schemes that can be introduced elsewhere. So, how can the public and private sectors combine their strengths?
A lot of these state governments have started rolling out these micro health insurance schemes, and you have a number of these schemes, whether it's Andhra Pradesh or Tamil Nadu or Karnataka, we've got all these insurance schemes coming out. Over and above that, we've always had ESI and many other, sort of public sector insurance schemes. How do we really sort of get the government to play an important role in ensuring that they are involved in supporting the healthcare system, because you do need the government to also support you in some way in building the sustainable model where they must make some money available for reimbursement?
I think, I'm afraid what may appear to you as a general response to me is a very specific response. The fact is, for every incremental rupee being invested in the healthcare sector, across the board, about 75 to 80% is coming from the private sector. This is a fact. The point I'm trying to make is that from these rural healthcare schemes, etc., if these rural healthcare schemes are realistic and they are sustainable, I see a role for the private sector there. I think the private sector will find the model, will create the model to become effective, efficient, and sustainable, and that will then bring the provider space, that will bring the education, that will bring the insurance space, and I think then you have all three sides of the triangle working in tandem.
So what you're basically suggesting is a model where the government is basically a facilitator or an enabler.
Exactly.
By saying, allow us to basically afford to build hospitals or clinics.
May I give you an example? The government of Punjab asked me to build a cancer hospital in Bhatinda. They gave us 4 acres of land within the precincts of the civic hospital, so at affordable prices. And they are saying that you give us 5% of the revenue that you earn in recognition of us giving you land at affordable prices, so that the payout for the land is spread over a long period of time. We will take that 5% and give it as a corpus to the civic hospital, and for any requirement of high-end tertiary care for patients who come to the civic hospital, we will use that 5% to be treated back in your hospital. So you see how that money is
circulating. So that's how they create the subsidized model.
That's how they create the model.
But it's a self-funding subsidy.
It's a self-funding system. So it works.
That's a very interesting model
that
for
quid pro quo
healthcare.
works. So I am saying, the minute I see that, I'm sure that once our hospital starts there, some mom and pop training institutions for nurses and allied health will pop up. somebody
has a multiplier effect.
as a multiplier, and then these external economies will develop, and this will spawn a total system for that area. It's infrastructure linked. People ask me, why don't you go and set up a hospital in rural India? Or why don't you set up a hospital in rural India? How do I take the physicians there?
Not just that, but how are you going to get patients who will pay for it? How are you going to get...
Paying is less of a problem, I dare say.
Well, in certain parts of the country it isn't, but in certain parts it is.
Could be. But so the economic model doesn't work. I can't attract physicians to go. I can't attract allied health professionals to go. So how can I set up a hospital? Similarly in health insurance, because don't forget, unlike life insurance and general insurance, it's a two-party transaction, the insurer and the insured. But in health insurance, it's a three-legged stool. Why? There's a hospital. Because if I am your health insurer and you are the insured, this transaction is incomplete till you actually go to a hospital to receive care. So I have to sell you a policy, you have to have the need, you go to the hospital, and then I reimburse the hospital. So it's a three-legged stool, and these three have to move together. And that's what I'm saying, that these three cannot move faster than the rate of overall infrastructure development and development of the economy, because the level of well-offness is dependent on how the economy does, the level of growth is dependent on how well we build out our infrastructure, and so on and so forth. But we don't seem to get that right. So for example, when you have townships that come up, outside the Delhi and the Bangalores and Bombays of the world, it's so haphazard. A residential colony will come up, but there's no school. The school will come up, but there's no shopping. The shopping will come up, but there's no hospital. And if all that comes up...
Basically, we know that our planning process has never been...
And sometimes all that will come up and there won't be a road. So it doesn't work like that.
So what you're saying is that the government really should be playing a role in, say, preventative healthcare, immunization, health awareness
that is where
creation, that kind of stuff.
And even that, they can entrust onto private people. They can say, we leave you with a target. I think that's a very, very good point. I missed that. In a sense, we're now almost bordering on public health. Immunization. Delhi, dengue fever, in the capital of the country, makes absolutely no sense. So government should compensate private players at a realistic price level and say, we are giving you area-wise, territory-wise, certain areas. You go do it. And this is how we will credential you, this is how we will measure you, and if you pass all these tests, we will pay you that amount of money. And if private sector sees an opportunity in that, you tell me, will there not be more takers than we actually need? There'll be a mad rush for people wanting to do that work. So let them do it. Let them do it.
Analjit Singh, the head of Max India, drives the business of both Max Healthcare and Max India Insurance. And he has been one of the pioneers in the sector. An entrepreneur par excellence, Analjit has made news for the deftness with which he has entered and scaled up new businesses. Singh believes that for healthcare to be successful and reach all, it will have to use multiple innovative platforms. And like Nandan Nilekani, the head of the government's ambitious UID program, he too believes in IT powering healthcare ahead.
Analjit, what seems to come out of all these conversations I'm having with various stakeholders in the healthcare sector is that, the private sector is a very, very strong partner of the government in building this healthcare system. And of course, I think you're right that, the government has not delivered on many of these issues in the healthcare system, and that is why there is a feeling that the private sector at least may be able to address this healthcare challenge. We haven't even touched upon things like how do we leverage technology, because the US today has actually outlaid $200 billion just for health IT. And we have to see how we can leverage our own software capabilities, our own IT capabilities.
Which is a natural in this country.
Which is a natural in this country to really build a very robust infrastructure for healthcare to be built on.
This is the IT and the cost-efficient creativity that can come, because this is a natural to our country, are the sorts of advantages the private sector can bring once the platform is provided. And once you do that, it will be the private sector which will innovate to bring in these IT solutions which will establish far reach because people can't go. IT can be a reasonable substitute for that. And what is a natural to this country, people will see that opportunity and deploy that.
Well, I think you're right. I mean, basically what we are saying is if you haven't built anything that has a semblance of a national healthcare system and we have to build it from scratch, well, why don't we, the private sector, help you to do all of this and execute on it in a very effective way.
And reward.
And all we want from you is to enable us to do that. Don't come in our way. Create that competitive, landscape. Create that efficiency-based model based on technology and IT.
Correct. And make it performance-linked.
And make it performance-linked.
Correct.
Again, I think, we need to really sort of mull over and conceptualize all these thoughts. And having said that, I would just say that this is a discussion that's very interesting, but more importantly, like you and I know, the time has come for us to really act. I think there are plenty of concepts, plenty of ideas. How do we get all of us to somehow make this happen? I think that's really the question.
One suggestion: do a pilot. It's impossible to go and convince the government of India and all the state governments to work in unison to create something at a national level. And it is not happening. It's too complex.
Do it at a state level.
Do it. Let's do it as a pilot. Let's do it even in half a state or a fourth of a state and see what works. And the market is huge.
It's huge. It's huge. There are huge gaps in our needs. We need 250,000, 2.5 million heart surgeries, and we only have a combined capacity of less than 100,000.
Exactly.
These are the kind of challenges we have.
And so, with IT, okay, with prevention, with scale, with local as now you're getting more supply of devices and the like, domestically than having to import at high prices and so on. If the cost of these procedures comes down, a typical knee replacement, a typical bypass surgery,
it's just numbers.
It's just numbers. There will be, more people, so-called more patients and customers wanting to come.
So you have to, of course, get efficiencies into the system. Standardization is also something which we have to look at. So I think
that's where government should work.
I think that's where
accreditation, standardization, quality. That's where government should come, and it should come on us hard to make sure that people deliver quality care. That's where government should come.
Anyway, that was great. I think it was a wonderful conversation. Plenty of ideas. Analjit, as always, you come out with some really, great ideas. Let's hope that some of these at least will, reach fruition.
Exactly.
So thanks a lot. Really,
it was
a pleasure.
And God willing, India will continue to, step up in all these ways. I hope so. Yeah. Thank you.